Hey guys, Phil here, Doctor of Physical Therapy. Today we will be talking about knee pain in pickleball. Knee pain is probably one of the most common complaints I see as a physical therapist, especially when doing anything athletic like pickleball and running. So we're going to talk about it. But before we really dive into it, we have to recognize that everybody is different. The knee is a complex joint and there are many things that may be causing your knee pain. So it's hard to make a blanket statement and blanket recommendation for everybody. But generally speaking, there are some common themes with all knee injuries, and that's what we'll focus on today. For example, if you are a young 20-year-old complaining of knee pain, that is a different situation compared to an older person with knee pain. The point is, everybody is different. And the goal of this video is not for me to go in depth about anatomy. You're not here for a lesson on anatomy or what can go wrong with the body. I want to give you practical steps on how to manage and address knee pain and a more practical general view on how to manage your symptoms. Okay, let's get into it. As a physical therapist, the number one reason why I see people with knee pain is playing too much. I know it's not rocket science, but hear me out. Pickleball is very addicting, and like many of you, I am also fully addicted to the sport. But what I see too often is people go from complete inactivity to playing pickleball for 5 hours a day. Sometimes that's just not sustainable. Trust me, I know when you're really into something, it's really hard to stop and just reel it in and pull back. But I see this far too often. Sometimes you just have to look at yourself in the mirror and recognize that you're overloading your tissues. You're overloading your knee, you're overloading your hips, your back, your body's aching. Now, what does that mean? Simply put, you are doing more than what your body is capable of handling. And that brings us to our first point on how to manage and prevent knee pain in pickleball, and that is load management. And that is exactly what it sounds like, not pushing yourself to the limit every time. If you're pushing yourself to the limit every time, every day, every game, and you're never fully recovered after a session of playing, that's a recipe for disaster. Especially if you're dealing with active knee pain, it can be really helpful to set some form of limitation so that you don't overdo it. For example, you can play every other day. You can set a time limit. You can play every other game. Incorporate a proper warm-up. You can check out my pickleball warm-up video on my channel. And sometimes playing smarter. There's no need to go diving for every ball, especially if you're not playing in tournaments. I can't stress this enough because no matter how much rehab, recovery, stretching, strengthening you're doing, if you are constantly overloading your system, that's not going to be helpful for recovery. So listen to your body. If you come home and you're limping around for the rest of the day into the next day, that's when you know you've overdone it. Next, we're going to talk a little bit about knee mechanics. So the knee is a relatively simple joint. It's pretty straightforward. All the knee does is bend and straighten. It's kind of like your elbow, right? All it does is bend, straighten, bend, straighten. It's not designed for too much twisting, rotation, and stuff like that. So a lot of knee pain actually originates from a lack of hip stability and a lack of ankle stability. And if your ankle's wobbly, look at what happens to the knee. Your knee naturally falls in or goes out, which will create some forces at the knee. And if your hip is not doing the job, guess what? It all goes into the knee. So it's important to build good awareness of body mechanics when you are doing anything active. So when you're playing pickleball on the courts, when you're moving around, make sure you're not doing anything too abrupt, too twisty. Try your best to keep your knees in line with your toes. First up, we have to talk about stretching. Stretching is under the recovery bucket. What recovery means is what you do after an activity to help recover from the stresses of that activity. So after playing pickleball, you want to do some recovery things to help you feel better, help you stay healthy. A lot of times the knee can get irritated if there's not enough flexibility through this region. So you have your quad muscles, you have your groin muscles, you have your IT band, hamstrings, all coming down to this knee area. And if there's significant tightness in the area, that can lead to proper mechanics when you're moving and on the field. So it's important to loosen up this whole area. And one good way to do that is with a quad stretch. So basically you're gonna grab onto your ankle, pull your heel to your butt, and feel that stretch in the front of your quad. And hold this for about 20 to 30 seconds or so. You can also incorporate some hip flexor stretching, which is the front of your hip. It connects straight down into your thigh and actually to the knee as well. So what you can do is get into this lunge position. You can hold on to a fence or something sturdy. You're gonna get down into a mini lunge, squeeze your glute on this side, and you should feel a stretch in the front of your hip and thigh. Also hold this for 20 to 30 seconds or so. Next, we have the hamstring stretch, which looks like this. So you're gonna straighten one leg, hug your thigh and just try to pull your leg up towards yourself. Hold it for 20 to 30 seconds on each side and pull and hold. Keep in mind that stretching is only helpful if you're dealing with some minor knee discomfort. Maybe you tweaked your knee, you haven't had much knee pain before, things are feeling a little bit tight. A quick stretch or two after your session can provide some relief. But if you're dealing with more severe knee pain or swelling in the knee, I would advise against static stretching because that may irritate or compress the knee even more. So listen to your body. If stretching bothers your knee, try not to overdo it. You can also add in some soft tissue work like self-massage with a Theragun or with a foam roller to help loosen up the areas around the knee. So with the massage gun, what you want to do is you want to go over all the soft tissue around the knee. So this is a great tool for just relaxing the muscles around the knee. But you don't want to go right on the kneecap or anywhere bony because that's just going to bounce off and be pretty uncomfortable. But you want to just kind of go around here, kind of loosen the tissue. You can go out to the side, right in the middle, or in the inner groin. You can also loop around to behind, kind of in the hamstring area. This is all good to do. You can also go up towards the hip. You can spend about like 2 minutes or so in each area. Something like this isn't really gonna hurt your knee, so you just do it until it feels good. If you don't have a massage gun, foam rolling is also really great for loosening up the whole thigh area. So what you're gonna do is put it under your hamstring, so behind the knee. You're gonna lift yourself up with your arms and just kind of roll back and forth. Right? Find any kind of tender spots. Roughly a minute or so is good. And then you can flip over to the side of the knee, the IT band area, kind of goes down into the knee on the side. You're going to lay on the side and just kind of roll back and forth. Again, just like a minute or so. If you find any tender spots, so I have one right there, you can just hold it for a little bit. And lastly, you can work on the front of your thigh. So this time I'm going face down, right? I have my elbows on the ground supporting my body weight, and I'm rolling on the foam roller, going back and forth, finding little hot spots and just holding it for a bit. You can go all the way down to just above the knee as well. Next, we're going to talk about strengthening. Strengthening is probably the most important thing to do to keep your knees healthy. A lot of times when it comes to any kind of fun physical activity, people only want to do that. It may be running, basketball, pickleball. I see this all the time. All people want to do is just pickleball. But that also can get people in trouble because if that's the only thing you do, you're not doing anything to strengthen the tendons and the muscles around your knee to allow you to play that much. So one of the best exercises for the knee and the hip is actually our lateral band walks. You're going to put the band around your knees or just above the knees. You're going to get into an athletic stance. Don't let the band pull your knees together. So knees in line with your toes. Both your toes are pointed straight ahead. Get into a little squat and you're going to take some lateral side steps. This is one of the best exercises for the knee because remember we talked about proper knee positioning. The knee is not designed to go in and out too much. So by training your knee in this position, you can build up strength so that your knee doesn't twist in. Roughly 10 to 15 steps one way and then 10 to 15 steps the other way. Also notice I'm not taking huge steps, right? I'm keeping tension on the band. I'm not letting my knees come together. And you should feel it on the outer hip area. Next, you want to do some type of strengthening or pressing movement with your knees. So what that looks like is a squat. You can use a dumbbell or kettlebell or even barbell. If you have access to a gym, you can use the leg press. Some type of pressing motion for the leg because that's a gross big body motion and it's going to strengthen all the muscles and tendons around the knee to help keep it stronger. So with the squat, you want to make sure your back is straight, chest up. Make sure you're bending at the hip and the knee at the same time and you're sinking down. I recommend picking a weight that is medium to medium hard that you can do for 3 sets of 8 to 12. And keep in mind, if this bothers your knee, what you can do is decrease the range of motion. So don't go as low. That way you can strengthen your knee without aggravating it. That's the whole point of rehab, strengthening without aggravating. Now, sometimes if your knee is really inflamed and aggravated, it might not even tolerate a motion like a squat very well. So what we could do instead is some type of deadlift motion. So this is what it looks like. So I have this dumbbell in between my legs. I'm gonna bend my knees just a tiny bit, so I'm unlocking my knees, and then I am bending mostly from my hips. So you see, I'm not letting my knees go too far forward. I'm just bending at the waist, slight unlock of the knees. I'm gonna come down and pick the weight up. This way you can strengthen your hips and your hamstrings without stressing your knee joint too much. I would pick a weight that is about a medium level of difficulty for 3 sets of 8 to 12. So start with the squats. If you can't tolerate the squats, you can kind of slide back and start doing deadlifts instead. But if all these movements feel good, you can incorporate some lunging. So for a lunge, you want to make sure you get nice and long, right? And then you're just sinking down towards the ground. This is what I like to start with for lunges, because sometimes people go straight into walking lunges or reverse lunges. And when you're moving too much, especially with weight, that's when form can kind of deteriorate. So I always like to start with a static lunge, so nice and long. And all you're gonna do is just come down towards the ground. And if that feels okay, you can start training it with some weight. You can hold a dumbbell like this, or you can hold dumbbells by your sides. Doesn't really matter. Find something that is challenging. And I want it to feel like you are challenging your muscles without too much pain or discomfort at your knees. Now, sometimes if your knee pain is really acute or irritable, things like squatting may seem like too much. What you can do instead is do some bridges. So this is called a hamstring bridge. I'm putting both of my legs on top of the chair. My knees are bent, so I'm pushing my heels into the chair, lifting my bottom up from the ground, going up and down. And you should feel this at the back of your thighs. If that's too easy, you can progress it to the single leg version. It's a great way of strengthening the back of the knee. Try to aim for 3 sets of 10 to 15. And here's another good bridge variation, and that's the glute bridge. So what this looks like is I'm pushing my heels into the ground, squeezing my glute muscles and lifting my bottom up, just like that. This is a really good way of strengthening the hips and the hamstrings without putting too much stress in the knee. And what you can also do, if that's too easy, is a single leg version. So I'm pushing my heel into the ground, lifting my bottom up, just like that. Try to aim for 3 sets, 10 to 15. And if you have access to a gym, the leg extension machine is really good for the knee as well. That's the one where you're sitting and you put a bar across your ankle and you're straightening against the resistance. Pick a weight that is about a medium level of difficulty and try it for 3 sets of 8 to 12. So I recommend picking something that is tolerable, meaning it doesn't get totally inflamed while you're doing it or afterwards, and adding it into your routine for 2 to 3 times a week. Keep in mind, this is just a general guide for knee pain. It's not the end all be all, and you have to look at it from a case-to-case basis. But some strengthening is better than no strengthening. So I hope you guys learned something practical from this video, and take care.